everybody, welcome to my channel. My name is Emma and here's Azarella. Let's see if you can see her. She's right next to me. Azarella, you want to say hi to everybody? So, yeah, I never thought I'd be making a video about losing a tooth, but here we are. Today I had to have one of my tooth pulled, the one over here on this side, and this is actually just the first step in order to go through the whole dental implant process, which is a lot longer than I thought it would be, actually, even though I did have an implant some years ago, but it was a little bit different situation. So, and I think I just forgot. I forgot also how it can be taxing on many levels. So I just thought I'd share. I know it can be kind of scary and overwhelming. Actually, any kind of major dental procedure. So I just wanted to tell how my experience was, how I coped with it, and what I learned along the way. So yeah, whether you're preparing for a dental implant or pulling a tooth or recovering from one or just curious, I hope these videos will help you and make you feel more informed and less alone. Yes, subscribe for more real life health and wellness experiences, and yeah, let's get started. I made some points for myself, so you will see me trying to address some of them. So actually this process was pretty lengthy because to get to this point, it took a few months. It was like a few months ago that I started getting a weird pain in this area, and I didn't know what it was. So I just went to my dentist, who happens to be also an implant specialist, because I had to deal with it before. I kept my dentist from then. So yeah, I think that actually makes a big difference, just to even have a relationship with your professional, whether it's a specialist, a dental specialist, or whoever. That makes a big difference in level of comfort, in knowing how we both work, how we approach things. So it's very comforting to know that I have somebody that I already know how they work. So that's important. But yeah, I was in denial for a while. I didn't want to believe that, there was something wrong there, but the pain persisted, so I had to go. And I couldn't get something right away, so I waited even longer. But eventually I got there, and once we did the x-ray and looked at it, it looks like there was an infection, but it was due to a possible fracture in the tooth. And this is a tooth that already had some issues in the past, so I knew it probably needed some kind of root canal or something like that. So yeah, I was in denial for a while. I didn't want to believe that there was a major issue, because I knew that would mean a lot of work, a lot of time off from work, to get the appointments, plus the financial burden, which is not easy. And if you don't have dental insurance, it's going to be even heavier. Although even if you do, if it's major work, it's not always covered that much. So either way, you have to bear the burden quite a lot. So it looked like it was not recommended, like the tooth was not going to be able to be saved. But just to make sure, I went to somebody else, and yeah, they kind of explained in detail what they're seeing, and it was the same thing. So once I realized, like, even though I want to save the tooth, like it wasn't like I would get to the same result because the infection would reappear once you have a fracture, it reappears. So in the long run, like I would come to the same conclusion later and I would pay even more just to do a temporary work. So that would be very temporary because like the infection is totally settled. So it would definitely come back very quickly. So just in preparation, just to have preparation for what was coming, it's just a lot of work. It's just a lot of work because you have to discuss what what would be covered, like make a list of what needs to happen. So taking kind of like making steps like pulling the tooth, the extraction, um, graft if needed for the bone, um, the implant, I forget the name of it, but it's like the first phase of the implant, the second phase, and then the final. Because it also needs to be split because I can't afford to pay it all at once. So yeah. And I think I also needed some uh night guards. So yeah, all of that adds up. I think the total that I'm paying is like 4,125. And these are prices, like these are Manhattan prices. But just to even be seen for my tooth, like the second time for the second opinion, it was $500. So it's a lot. It's it can add up very quickly. So it's painful on multiple levels, like financially, physically, planning wise, making sure going through the doubt, like, am I making the right decision? Then having to consider um what kind of materials are used for the implant? Is titanium right? Like so many questions. So so yeah, eventually we came to an agreement. What's on the list? How much is the total? How is it going to be split out into maybe like 6 payments or something like that? And usually the first payment is almost like it's kind of like a down payment, it's like a bigger amount. So yeah, so the day came, and I usually try not to think about it when I have the appointment because I know I've had a tooth pull in the past, and it was kind of hard. It was not. It was in a different place that I went to, so it was not the same. I know it was when I was much younger, but yeah, I don't have the best experience there. So I was a little bit anxious, like actually very anxious. I just try not to think about it until that day. So like it was today. Today I had to think about it. Luckily, I had a morning appointment, so that helps a lot to just kind of get it out of the way. But yeah, I was even anxious about I was even anxious about um the injections for to get numb because it's a lot of having to get numb all around. And that's why I think it's so important to have like develop a relationship with your doctors, dentists, specialists, whoever you have, because it helps you know how they work before these things come up. So I knew that my specialist dentist, like he's amazing. And but in those moments when you go through this, it's nerve-wracking. It's my body was almost shaking. Even though I trust him, you know. Yeah, but there is a process. First you gotta get the injections, then you wait 10 minutes for the numbness to be complete. And then the process, it was really helpful to kind of have heads up like, hey, this is what you might be feeling, this is what you're going to see me drilling, and don't get scared, like it's just part of this. So it helps to kind of have heads up like of what's coming, what it might look like. One of the surprises is there's a lot of sensations that go into going through this process. Like there's the dental smell, although having kind of like Orajel or something um, before the numbness helps a lot. Um, but when the drilling is happening, then there's like a burning smell. So that that seems to be triggering for me. Like just yeah, and things kind of flying everywhere. Um, Definitely helps to have the glasses on, like some kind of plastic glasses, just to kind of not have things in your eyes. But also, it's like it's like a thing like uh having control over like this area. Since I don't have control over this area, maybe having something over my eyes actually like it gives a sense of like, okay, I'm okay. So what helped me get through it was um just reminding myself like I'm here, all is well, everything's going smooth and as planned. Um, I also do like a prayer, um, asking for support during the process, just to, I feel like, I don't know if it helps or not, but like it gives me a sense of comfort to know that I'm not alone going through it, even though I have my dentist with me. Um, but yeah, so that's that. Let's see. Am I missing anything? One second. Let's see what's going on. Okay, so yeah. Let's see what else. In terms of the what is it, baby girl? You want to say hello? You want to say hello to everybody? Here we go. There she is. Yeah, she's sitting with her mommy. Right? Um, so yeah, in terms of the actual experience, um, let me see. I'm trying to think. No, I can't say it was painful, but I can like I definitely felt a lot of sensations, a lot of physical, just stretching of the mouth, and I could see that things were happening. There was drilling, there was I'm not sure what else, because yeah, yeah, I was very numb in this area completely. So, which was good. Yeah, I definitely don't want to feel more. But there's awareness, like I had awareness of like a lot going on there, a lot being kind of taken out, um, drilled, things spilling all over. Um, so I think the hardest is probably the injection, but like my first experience was different. So like where they had to pull the tooth out because it was broken, so they had a hard time pulling it out. So that I felt a different. This time it was a much better experience. And again, just knowing, the style of the dental specialist and everything, is actually very important. Um, the hardest part, what was the hardest part? The hardest part, I think, for me personally, is the injections for like that, where they numb the whole area, because several. It's not just one. So, and I tend to have vasovagal syncope, which is like a form of having the possibility of fainting or having a range between not fainting and fainting, like of sensations. So yeah, that happens. So yeah, because not I don't think everybody has vasovagal syncope, but I do. So that can complicate things, because if one of my triggers for getting the sensations of dizziness and complete sweating instantly all over the whole body, and kind of like having a sensations of being under the water, or hearing like as if I'm under the water. um but I don't faint completely. It's just the in between kind of. So, but it's a feeling of losing control of your body. So, like of my body. So, like it's not fun. So for that, what I what I usually have to do is give heads up to whoever, in this case, the dental specialist, that I might need to put my legs up, and the legs are supposed to kind of be up above the heart rate. So like the upper body lower and the lower body legs up above the heart. So, and that has to be done quickly at the first sign of those symptoms, which the first symptoms is instant sweating everywhere, the whole body, in a profusely manner. Um, so like if I don't put my legs pretty quickly, then I'm still gonna go through a whole fun ride, which is not fun, of losing control and just needing, yeah, I probably need a break for a while to kind of recover from that. Um, and then usually I anticipate it coming back, so I fear it quite a lot. So that's always a fear of the vasovagal syncope symptoms being triggered by in the dental office, because the medical smell of things usually is one of my biggest triggers. Um, I've had this since childhood, and I didn't know until one of the doctors um, kind of explained it to me. So I was very happy to understand it and to know what to do about it. Um, so that complicates, any kind of major procedure for me in that sense. So yeah. But I would imagine not everybody goes through that. It's just my tendency. Lucky for me, I didn't have to go through um any vasovagal syncope, any, fading or almost fading sensations. So I was very happy. I was not triggered. Doesn't mean that it was easy. My body was like shaking because I kind of knew what to expect, but not completely. So yeah. Um, yeah, I go through a lot of anxiety. So I would imagine other people go through anxiety when going through major work for dental stuff. Um, so yeah, it's just working with myself, like knowing what I need in the moment, knowing what I tend to go through, like the vasovagal syncope, which usually it's almost like my body senses if somebody feels like trusts the person. If my body trusts the person, they're like, okay, cool. Yeah, I might be scared, but we're gonna go through this and it's fun. But if my body on some level doesn't trust the person, which is not a conscious thing and it's not an intentional thing, it's just something that's almost out of my control. Um, so yeah, if that happens, then yeah, I go through the triggers and then I have to wait to take a break and deal with that and then come back to it. But usually I come back to it more scared. So I'm happy that this didn't happen this time. Everything went smooth. Um, I think one of the most difficult thing is also not knowing how long things will take. Like, oh my God, is the drilling over? Is the whatever they're pulling like from the tooth parts, like, is that over? Like, are these sensations over? How long do I have to like completely keep my mouth open to the maximum and have all these fluids everywhere? Um, so yeah, not knowing the length of time, it seems like time kind of gets more focused, more condensed in those moments. So I think that's what's painful sometimes. Um, because it can, like, to my mind, it can feel like, oh my God, this takes forever. It's not forever, but it's just how I'm experiencing it sometimes. Um, so yeah, it's really nice just because you get a piece of paper with the instructions. So yeah, I asked if I needed any, antibiotics or anything, but my dentist said that he doesn't want to overuse the antibiotics. I already had because I had to deal with the infection on the tooth uh like a few months ago. Like he doesn't want to overuse them, which makes sense. I didn't think of it right away, but it makes sense to be thoughtful about that, so we don't become resistant to antibiotics. What else? So yeah, when I left from there, I was numb for I don't even know how many hours, but a whole bunch of hours afterwards. And then the numbness kind of fades away little by little. Um, yeah, and there's a gauze that kind of gets moist. Um, and there are specific instructions to not rinse and not spit any of the saliva out because it does something that's protective. Um, so and yeah. So like afterwards it's kind of like some more sensations of it's like a weird sensation in this area where um there's there's moisture, there's probably blood, right? There's a lot going on there. So it does feel kind of strange, and there, I did smell a little bit of the blood too. Um, so yeah, I felt like I'm slower, like I need to be thoughtful, careful. Um, I still I didn't realize for a while until I got home and I rested, but I felt like I was in a state of anxiety, um, like fight or flight mode. I definitely felt like my body was heightened with those sensations. Um, yeah, and it took a while. I took their advice and just kind of rested because I was tired also. And yeah, I definitely took the day off. Um, the first 2 or 3 days, is recommended to kind of eat soft stuff like cottage cheese, yogurt, um, oatmeal, what else? Apple sauce, stuff like that. So that's what I'll do. I went straight to the food shopping and I got myself situated so I don't have to wonder, so I can have everything. I added tahini to my mixture, so now I mix a little bit of cottage cheese with tahini and a little bit of apple slice sauce on next to that mixture. So it tastes really good. I'm actually surprised how good it tastes. Uh, I actually enjoyed it. And then after 3 days, it's like the next 2 weeks, I'm allowed to eat, kind of like chopped meat, eggs, pasta, whatever. Still kind of soft stuff. Still have to be thoughtful and more on the opposite. Eating more on the opposite side is very recommended. So yeah, it's not gonna be necessarily easy, but it's not hard either. It's doable. It's just yes. Oh, and I'm getting as I'm talking, I'm getting almost like a feeling of sand in the area, which my dentist told me that I might feel that, and that's normal. So, so yeah, I think the hardest part is also the recovery, the emotional recovery. If you happen to be kind of an anxious person, that will take a little bit extra. It definitely took me kind of the whole day. I'm starting to come out of it. I'm much better now, but I still feel like my heart is like like it's holding tight, um but I'm very happy that it's over, at least with this first part. Unfortunately, there's more to this. This is just the beginning, but I do think this is the hardest of the whole process. This probably the tooth extraction is the most important and the hardest. After this, it's gonna take 2 months for the tooth area to heal. And then after 2 months, I can be seen again and then going through the next steps. So in total, it's going to be 6 months until I get everything done with the final, implant. So like the next time, I think it's going to be like measuring and like a temporary crown there to kind of hold um, the impression for the implant. Um, which I'm grateful that it's split into phases because it can be overwhelming. Like I wouldn't want it to do everything all at once. It can be way too much. The only fun part that I'm not looking forward to again is the injections. Those are triggering in the gum, the numbing injections, those are triggering. So like I always have to prepare a little bit that I might get vasovagal syncope, but at the same time, I haven't had it in a long time, many years, but it can come back in a second if triggered, you know. So that part I'm not looking forward to, but I will be okay. I've gone through it many times. So yeah. Um Another consideration is socially. Uh in next week is gonna be July 4th, and for that weekend I will be going sour cherries picking to in a at a farm with a group of ladies. So I just realized like, yeah, I'm not sure if I can eat any of them, but I'll collect some. I'll be picking them. I'll probably enjoy everything else, but I don't think I'm gonna eat those. So it's just consideration. It might impact some of the social stuff. Um, the first 2 weeks is a little bit of extra healing process. I think it does get better and easier after those 2 weeks because then there's already like a foundational healing that has already happened. So, yeah, there's a lot more consideration for the first 3 days and then 2 weeks. And after that, a little bit easier, but still, probably have to eat on the opposite side of the mouth. So, that is that. Let's see what else we have. Um, right now, am I struggling with eating? A little. Yeah, like I'm not gonna put anything in that area. And the first time that I was drinking, oh, you know, I was not allowed anything hot, anything food or drinks hot, but cold, they're okay. So I had a can of seltzer, and that had a very strange sensation because it's almost like a fear, like, oh, don't go here, especially if it's cold, and feeling the sensation, it does feel like it's taking my breath away. But the first few times it was kind of strange. After that, I was like, okay, I think I can drink. Um, and I did change the gauze because it does get completely moist, so it probably does need some changing. However, I have to say that I did not need Advil or Tylenol. I didn't need anything for the pain, so it was manageable. It was manageable. I was expecting that it would be a lot more painful, like after the sedation of this area wears off. Like I thought it would be more painful, and it wasn't. Oh, that's my doggy. Yeah. Okay, so let's see. In terms of the procedure, what was explained, um, yeah, I think it's important to know what's coming your way, what kind of sensations you might be feeling. Like, and if not, you can ask, I definitely ask my dentist specialist, like if I have questions and I'm wondering, I try to ask as many questions as I feel I need. Um, and he usually explains them very, very well, very detailed, and it kind of puts me at ease, like it makes me feel comfortable. Um, and at the same time, I feel like there's a balance. Like I want to know some information, but I also notice if I know too much, that can work in my detriment because then I worry about it. So like it's just that fine line of maybe a couple questions and that's it. Keep some I like to keep some limit. Oh, how are you, baby girl? Oh, she's getting bored, my doggy. She's right here. Yeah. So, what else? There was pressure. Um, yeah, but everything was manageable. I think it's more psychological sometimes, just not knowing, oh, how long is this pressure taking or this procedure? When you're in the middle of the moment, uh, it can stretch to feel like forever. So, like for me, also going to an office where they have windows is very important, just because it kind of it helps me to kind of either look in that direction or what else? There are times when I choose to just not look and have my eyes closed because, oh, one of the tricks that I use is um to close my eyes when it's the most intense, the procedure, because if I don't want to see the utensils of whatever the dentist's using, because then my imagination is jumping ahead. So by not seeing those utensils, I don't have to worry about stimulus. Um, so yeah, that helps me a lot actually. Um, I will feel the sensations, but like I make a point to just not look at what's being used. So sometimes it's better to just like squint the eyes and just like, you know, uh, let the dentist do his job, basically. Hi, what's the matter? You okay? Somebody's getting a little bored, huh? We're almost done. So yeah, recovery. There were stitches, by the way, but they're dissolvable, so that's nice. And I felt as he was working through with the stitches, it seemed like a very kind of detailed sort of work. Um, and it is kind of strange to feel that in your mouth, but it was not painful. No, that part was not painful. Um, and pain afterwards. No, it's even right now, like after at the end of the day, it's a little bit of a sensation, but it's not like anything major, like major pain or anything. Obviously, I didn't even need to take medication, even regular medication. So I'm very happy. And I think when I did it before, I needed every medication that I could. So this time is such a positive experience that I'm very happy with how everything went. I'm very satisfied. I feel relieved. And I'm okay with having 2 months break for healing. And yeah, I look forward to the next ones with a lot ease in my heart. Um, yeah, so I feel kind of like back to normal by the end of the day, but a little sensation there, and it like I do feel the hole in there, and it's very strange to have that. So it's an adjustment, even mentally and physically, to feel that. So that's gonna take me probably a while, a few days, a couple days. Um, so yeah, in my case, I did not have um dental insurance coverage, so I pay from out of pocket. So it's a lot, but um I feel like this is teeth are such great support for all of our health that it's a very important investment to make and to not ignore and not neglect. Um, and I know that every case is so individual, like in terms of what's going on, what's needed, and how much things are, and everybody's insurance situation is different. So I get that. But whenever possible and as much as possible, like, and I try to remind myself how important it is to support my own health, support and yeah, are the foundation of support. So, and I'm thinking like, I'm gonna get older, so I need to have a solid foundation, especially since I don't think I started with solid foundation early on, but that's another story. Mm. Was it worth it? Yeah, for me, it's worth it. For me, it's worth it. But at the same time, there's always a risk. You don't know how it's gonna be. I didn't know. It could have gone in many different directions, and I had to be aware of that. That I guess that's part of my anxiety because I can think of all these different possibilities, and I'm aware that it can go in many different directions, and there's no guarantee. Like it can go in a direction where there's more pain, or something to you know block the healing or whatever. Situations can happen that might be unexpected. So, yeah, one step at a time. Sometimes this work can be pretty big, pretty major. So it's hard to see even two steps ahead. Sometimes you gotta just deal with that day. So like today, I just said, just gonna deal with today. If I can overcome like getting through the day and get to the end of the day and feel good, like that's a huge accomplishment. So I feel like, yeah, that's what's happening. I'm very proud that I was courageous to get it done, you know, because it's almost like I have to coach myself like, hey, all is well. I'm in good hands, professional. Um, a little bit of self-coaching goes a long way in those moments that are needed. So, but in my case, I do have to work with myself a lot in this kind of particular day. Um, but yeah, uh, do I re do I regret any part of it? No, so far no. But we still have a way to go. Like, so we have, let's see, July was, yeah, like until the end of the year. So right now is July, so we have 6 months. I will follow up once I'm done completely with the whole big work that is ahead. However, today was a big accomplishment, just getting through the hardest part of it. So, yeah, no regrets. No regrets here. Would I do it again? Yeah, I've done it before and I had to do it now, and if needed, I would I will fight for my health. Yeah, even if it's hard. So, yeah, I would do it again. Um, yeah. Um, like I said, one step at a time. It's okay to be scared. It's normal. And sometimes we might need to kind of like remind ourselves, like I definitely need a reminder, like all is well. Like that's my kind of go-to. All is well. Um, I'm in the hands of professionals. Everything's going smooth, and I try to bring it into the present, like not in the future, uh, so that I can feel it now. Um, yeah, and if I have any questions, I had questions. What did I ask? I think I asked like what materials are used for the implant, what to expect. Yeah, whatever comes to you, it's good to ask questions. Sometimes it's reassuring. However, like I also remind myself, not too many questions. It's okay, one, two, maybe three. But beyond that, you don't have to know everything. Like at least in my case, I remind myself I really don't need to know everything because sometimes if I know too much, my imagination also grabs onto that. So, so if you've gone through anything like that, comment below, and I'd love to hear your story. Like, subscribe, and share if you think this is helpful for anyone else. And I will follow up with the completion of this major project uh, at some point again, between now and the completion of the major work. I hope you're healthy, stay healthy, and talk soon. Bye.